14 bankrupt municipalities, reports of COVID-19 patients dying on the street with no access to healthcare, and a hospital with 1,000 available beds but no staff to work in it. While all of this is happening, medical waste is piling up in the corridors of other hospitals because the cleaning staff are refusing to work. This is the current nightmarish reality of the Eastern Cape as it heads towards its COVID-19 peak. Now, to talk to us about this crisis, we're joined via Skype now by investigative journalist Estelle Ellis. Estelle, a good afternoon to you. Thank you so much for joining us. You've written a nightmarish, I think that's really is the only word I can think of at this point, about the situation in the Eastern Cape. What's interesting, though, is that you also have this governance battle that's taking place in the province, conversations around an MEC that should or should not step down. How much of this really is a governance issue, according to you?
Look, I think the neglect of the Eastern Cape Health Department's been coming on for probably more than a decade. You know, if you end up with a health system that needs that has 6,500 vacancies, it's not the work of a single MEC or a single head of department. And I think what the bigger problem is that now COVID-19 has put the health system under tremendous pressure. And so now it's basically cracking. But yeah, I think at this stage, it doesn't really matter whether the MEC goes or stays. I think I agree with the Premier. I think we need more interventions than just a political one.
Yeah, I mean, the Premier today was quite optimistic around the direction that the province is taking, saying that, you know, some steps have been taken, there's some resolution. But tell us about what you found when you've spoken to some of the health professionals in the province. I believe one health facility with posts that were only advertised on the 26th of June. That's horrific.
Yeah, so what we have is they've opened a field hospital in Port Elizabeth with more than 1,000 beds, I think close to 1,400 beds. And a lot of these beds are equipped with oxygen, which we all know by now because everybody has received a lot of information on COVID-19. So very sick patients need oxygen. But this hospital doesn't have staff at the moment. When it was handed over to the Department of Health, the Premier did say that they have employed 5 doctors and 40 nurses. But, you know, you need pharmacy assistants, you need pharmacists, you need radiologists, you need people who will run high care, and you need more than 5 doctors. So these jobs were advertised at the end of last week. It does beg the question, though, that if you knew this was coming, why only advertise now?
Yeah, I'm struggling to almost go through all of the challenges that are faced by the province, because there are so many. Millions that were spent on scooters that are supposed to give access to far-flung areas, but those scooters are only going to be available 3 years from now. And then there's the basic health services that have been available all along, that in fact now continue to buckle under the pressure, the likes of maternity wards struggling as well. What have you found there?
Yeah, so we've got a centre for maternity specialist care. So people with complicated deliveries go there, or very sick pregnant mommies. I think they have about 19 or 20 pregnant women who have tested positive for COVID-19 are being looked after there. And the Department of Health actually now admitted that the patients were basically abandoned by the nurses, by general assistants who do the cleaning and the food service and things like that. And that was left up to the doctors to run the entire unit, you know. And I mean, if you have a doctor who must clean his own theatre between doing cesareans, we've received reports of a woman who died of very traumatic death in the passage while giving birth. Those things are heartbreaking, and it's unnecessary. This should not happen in any hospital.
Yeah. It's heartbreaking. Estelle, thank you so much for speaking to us. And I know that you continue to run these investigations into the health system in the Eastern Cape. We hope that we'll chat some more in the future. Investigative journalist Estelle Ellis speaking to us there around the health systems in the Eastern Cape. If you are in the province, share your thoughts. Get on Twitter. The handle is at ETV News SA. You can use our WhatsApp line as well to send us text messages, voice notes and videos. Perhaps you tried to access some assistance in the province and had some trouble. The number to use there, 082 777 0735. Email newsroom@etv.co.za. Let's